disciple Ramananda Swamigal, his main disciple disorders. Before entering to the subject, once more, I know you all are very well thorough about the subject with the last around 7 series of classes. Anyway, once more we have to just remember the main topics, that is thyroid gland is a factory of 3 types of major hormones, T3, T4 and calcitonin, which have the major role in the overall metabolism of our body, giving stimulation for prolactin synthesis, activation of mitochondria to regulate metabolism of all other organs, for which iodine is a major component, which is not producing in our body. Thyroid gland only can absorb iodine from the food items and from the oral medicines, which convert it into thyroid hormones T3 and T4, which release to bloodstream, through which entering into all organs and regulate their metabolic activities. Conversion of prana energy and food essence to energy for all our physiological and as well as intellectual functioning. So this basement theory should be there in our mind always. We can see there are mainly 4 types of complaints. You know very well that hypothyroidism, hyperthyroidism, that is overactive, and thyroiditis and nodular goiter. And in hypothyroidism, the main reasons are lack of iodine, drug-induced maybe, autoimmune, transient reason, any excess growth, vascular infections, trauma, or any congenital disorders. That all I know, but you all know very well. The symptoms: excess fatigue, hair fall, abnormal thinning of hair, dry skin, brittle nails, loss of appetite, abdominal extension, then goiter, weight gain, growth retardation, lack of sweating, periorbital edema, etc. In hyperthyroidism, occurs when thyroid gland produces too much of hormone thyroxine, and it can accelerate our body's metabolism, causing unintentional weight loss and a rapid or irregular heartbeat. Increased symptoms are increased appetite, nervousness, restlessness, inability to concentrate, excess fatigue, irregular heartbeat, difficulty sleeping, itching, hair loss, weight loss, etc. In thyroiditis, any type of infection or inflammation. We can see 3 types. In first stage, it is thyroid is inflamed and releases too many hormones. In the second stage, whenever these hormones releases in maximum quantity, this leads to a lack of thyroid hormones and hypothyroidism may arise. Then third stage, you throw a phase, it will come to a normal level. Then Hashimoto's thyroiditis, silent thyroiditis, condition caused by antithyroid antibodies. Postpartum thyroiditis also, you know very well, radiation-induced thyroiditis and subacute thyroiditis. Acute thyroiditis or suppurative thyroiditis also are there, and drug-induced. Drug-induced, say a condition is caused by the use of drugs such as amiodarone, interferon, lithium, cytokine, etc. It only occurs in a small fraction of patients, so it is not common. But with any Ayurvedic medicine, there have no chance of any thyroid complaint. I haven't noticed yet. Then goiter. Goiter refers to an enlarged thyroid gland. Sometimes a person can have a goiter that has multiple nodules or lumps that can compare with our Gandamala. One main cause of multinodular goiter is an iodine deficiency. The symptoms are swelling, a tight feeling on the throat, cough, hoarseness, difficulty in swallowing, difficulty in breathing. That comes in thyroid goiter. When a patient comes in our OP with the suspectable symptoms, First of all, we send them for an first a routine blood test with EFT. Then if there is any much error or increased or decreased value, we can do a USG. Then if there any symptom of malignancy, have to undergo MRI neck and followed by, if need, thyroid biopsy. Then Galaganda, in our text, Ashtanga Hridaya, we can see comes in Kandagada Roga. It have 3 divisions: Vadaja Galaganda, Kabaja, and Medoja Galaganda. Vadaja we can compare with hyperthyroidism, and Kabaja we can compare with hypothyroidism, and Medoja goiter. Galaganda Pavanasreshma Medobi, Galagando Bhavadahi, Vartaman Sakalena, Mushkavat Lampati Niruka. Then Vadaja Galaganda, the detailing. We can compare the symptoms with the hyperthyroidism. Susruda detailing is here. Then Kabaja Galaganda, Skira Savarno, Ankaru, Ugrarandu, Shido, Mahashabi, Kabatmakatsu, Jayabhivruddhi Guride, Chiracha, Prabhatyade, Mantarja, Kadajita. We can compare it with hypothyroidism. Medojagalanda, Nigdo, Mrudu, Pandura, Nishtagado, Maida, Krudo, Niruga, Datigandu, Kalambade, Labuat, Alpamundo, Dehaniruba, Chayavruddhipta, Snigda Seda, Tasya, Bavecha, Jendo, Galayana Shabda, Gurudecha Nityam. Then we can analyze the above factors. We can see all the complaints are the after effects of Rajasiga or Tamasiga Ahara Vihara Shila of new generation people. We know very well that the most common habits or Shila of new gen people nowadays are Ratri Jagrana, Ivasopra, Adi Krodha, Adi Apravrti, Asamaya Bhojana, Ati Bhojana, Hina Bhojana, Vidahena, etc. By following the above factors in our life, gradually starts a deranged metabolism, altering all the functional activities of all organs, finally cause for thyroid, mainly thyroid disorders, liver disorders, heart complaints, diabetes, hypertension, etc. Hence, lifestyle modification have major role to prevent especially thyroid complaints. What is the lifestyle modification? At a glance, when we analyze what is going in and around the surroundings, we can see most of our new generation people from their school time itself are following a health-wise negative attitude. Example, late night awakening. Most of them are going to sleep after 2 or 3 a.m. we know. Then late night to up to mid-noon sleep. More non-veg and fast food items in diet, lack of that and time also, lack of regular exercise, high-grade stress and mental worries, etc. These above factors alter Dhatu Pata as well as deviate equilibrium of Pradosha. If we adopt a healthy lifestyle, means Sattviga Ahara Viharashila, according to Ayurveda, that is starting the day with Brahma Muhurte Jagrana. We know that around 4 to 4:30 is the early morning awakening time, the best time. And followed by then the Dhavana, Snanadi, Dhyana, Pranayama, Yogadi. After this only we have to start our routine daily activities, through which what we are getting is fill the mind with full of positive energy, can keep punctuality in daily routine activities, can keep positive thoughts like happiness, kindness, love, and caring mind, respectfulness towards ourselves and everyone, release all negative thoughts like anger, hatredness, jealous, guilty, depression, worries and all types of tensions, etc., through each exhalation, especially at time of pranayama, breathing exercise. And can take easily, we should take easily digestible, fresh and timely diet with more vegetables and fruits. Do mridu sneha sweda virega in mridu sandhis. Take preventive and rejuvenative rasayanas in regular intervals, especially after this cell by cell cleaning. And keep optimistic mind. Also, keeping always positive attitude, loving enemies, sharing all extra things we have to needy poor people, keeping morality throughout the life. By the above things, we can keep our mind and body clean, healthy, and can prevent all types of diseases, especially metabolism altering diseases like thyroid complaints. The above things reduces the stress level by producing endorphins, dopamine, serotonin, and oxytocin like positive hormones, which releases only by regular exercise and mindful laughing, helping others, and by the presence of dear and near ones, which help to normalize all other metabolisms also. Do a cell-by-cell cleaning, repair, and empowering of all vital organs, especially hypothalamus, pituitary gland, and thyroid gland, etc., arising a harmony in their overall activities. With just simple following the above factors. Hence, we all should follow a healthy life with 5 sakaras, which are to help the above things. What we have to continue throughout our life, that are Sat Chinta, Sat Karma, Sat Sangha, Sadhu Seva, and Satyashila, as prescribed by Charagacharya. In Janapadodumsaniyadhyaya, we can see these only the measures to prevent any climatic calamities or any other calamities. We all should keep these 5 items. The same time, if we follow a negative, stressful lifestyle, there may arise excess negative enzymes like cortisol, which diminish the function of pituitary gland and other vital organs, which pituitary gland, if altered, which break the release of TSH. Then, the treatment modality, if analyzed our Ayurveda text, we can see for all types of thyroid complaints, common treatment protocol is first of all Shodhana Karma, cell by cell cleaning of the body with appropriate Panchakarma items, then Shamana, medicines and treatments, Kapunarbhava. Selection of drugs and treatments vary according to the type of disease. Doctor, is it audible now clearly? Hello, doctor? Hello?
It's audible, ma'am. Hello?
Oh, okay.
It's audible. Yes.
Okay. Then, our Shodhana part include Mridu Sneha Sweda Virega. Shamana Chikilsa included Kashaya, Varanadi, Tayamyadi, like, because most of the thyroid complaints, we can see more than 90-95% of the cases are coming as a hypothyroidism. So, the following medicines are mainly for hypothyroidism or goiter or thyroiditis complaints. Kashaya, Varanadi, Trayamyadi, etc., Lehya, Gulgulu, Tiktaka, Madhusnehi, or Mir Madhusnehi also. Gudiga, Kanchanar, Gulgulu, Protect Tab, Lehya, Bahileba, Nagaradi, KM Lebam means Kartavarmani. It is of Kerala pharmacy. Nagaradi Churna. It is also available as Manikundirikadi Churna of from Nagarjuna, and other companies, I think it is as Nagaradi Churna. It is highly effect in this case. Gaitarin ointment also is there. Gaitarin tablet also highly powerful. Shiroleba, for the Shiroleba, Pungavi plus Varachurnam. By mixing with Varakashaya, we can do 1 hour Shiroleba for external application locally. Nasya Varanadik Shiraguda. Raktamoksha by Jaloga or as scalp from both elbows, both hands. Apunarva Chikitsa includes Snehasweta Vireka in Rudusandhis, following preventive medicines like Kanchanara Gulgulu, Paranadigrada, Gulgulu Tikkagrada, mainly by lifestyle modification like Satyuga Ahara Vihara, following yoga, Dhyanadi. Apunarva Chikitsa we should instruct for all patients. Patya and apatya diet for thyroid patients. All types of ichapatya aharas. I think you know very well that according to the climate and place change, we have to arrange what all items can anyway normally easily digestible cereals, vegetables, fruits and nuts, chikku comes in patyahara. Salt for cooking should be iodized. And should be strictly avoided. The items are tapioca, cabbage, cauliflower, brinjal, and all non-veg items and fast foods are in the group of apatyahara. And in normal situation means just to prevent thyroid complaints, sea fish are favorable. But at time of any infection or excess growth, that also should be strictly avoided, and instead of that we should take direct hormones and iodine with iodized salt, etc. Patya and apatya in vihara, regular exercises including yoga, walking, cycling, dance or any indoor or outdoor games should be selected according to the personal need. Avoid nighttime duties. And if it is necessary, after the nighttime awakening, then should sleep half of its time in the daytime. That is, if we lose 4 hours sleep during night, definitely should we should sleep for 2 hours. It is preferably early in the morning, otherwise after lunch. Then be happy, relaxed, and optimistic always. Then special patent medicines for hypothyroidism. In my experience, Cap-Thyronil, which is of Vaidyaratnam. Then Tab Gaitarin, it is of Arya Ushadi Pharma. Then Cap Tumovin. Tumovin is especially for goiter. SKM Siddha of Coimbatore. Then Cap Thyroflux. It is Orex Pharma. It is of Thyroflux is the most powerful and easily working medicine. The Thyronil, Gaitarin, etc. will take little more time to make the hormone level T3, T4 or TSH to the normal level. We should treat the patient with an overall, before starting these medications, treat the patient with an overall cleaning, repair, healing and rejuvenation of all body to prevent or cure all other comorbidities like diabetes, hypertension and cardiac complaints also. Then the treatment modality, if we analyze, first of all, we should start our treatment with the Chodhana and Shamana part, along with already taking modern medicines like Thyronam, Thyroxine, L-Troxin, etc. That is I am doing. Up to in all my past 28 to 30 years of practice, I was doing like that. Continuing the modern medicine, we'll start the treatment with our medication, and every 3 months should recheck the TFT level And whenever it comes to very normal level, gradually taper the dose of the modern medicines, and then finally can stop. Within 3 to 6 months or maximum within 1 year, we can stop that medicines, and gradually our medicines also can stop. Then do tri-monthly checkups of diabetes, hypertension, and taste levels, and rearrange the dose of medicines and analyze the swasthya lakshanas and taper the dose of modern medicines. And maximum within 1 or 2 years, we can stop all the medications. That is my experience. Then Brahmana as well as Rasayana model therapies have to be selected for Vadika Galaganda or hyperthyroidism. And Lankana with Lekhana model medications and treatments should be done for Medoja, Galaganda or goiter. And Lankana model medication and diet which rejuvenate the action of thyroid gland as well as pituitary for /Meja Galaganda or hypothyroidism. Any type of infection or inflammatory condition or for the thyroid gland comes under thyroiditis. For that, we have to concentrate on anti-inflammatory drugs as well as Panchakarma therapies like Sneha, Sweda, Virega, Tikshna Leba, Tikshna Nasya, etc. Within few weeks, we can see maximum cure of the disease by relieving all inflammatory symptoms and other complaints. Then importance of yoga and dhyana. A daily practice of some simple yogasanas induce maximum prana energy to our brain energy centers, that is Shat chakras. You know that Mooladhara, Swadhisthana, Manipura chakra, Anahata chakra, Vichuddhi chakra, Ajna chakra, and Sahasrara Padma, which empower all vital organs through which, including thyroid gland, brings harmony in their functions. That is the we can see that wonderful action in very little time than the medication with the yoga and dhyana. Simple yogasanas which can be done for all age group, I have noticed are this Malsyasana. Malsyasana for old ages we can suggest to them not do in the Padmasana Yoga. Instead of that, Pasarita Pada. If they have any arthritic complaints, especially for knee, it may not be easy to fold both legs. So it is better to do with the Pasarita Pada, Malsyasana. Then Pavanamuktasan, Vama, Dakshina, and Purna, Merudandasan, Bhujangasan, Dhanurasan, and Magarasan. Magarasan for 15 to 10-15 minutes, and other simple items 3 to 5 times, total of 15 to 20 minutes favorably early in the morning. We can prevent more than 90% of chances of thyroid complaints with these simple yogasanas. So we should insist for all our patients. We should teach them well and insist them to do daily as a part of life. Then when it comes to Rasayanas, we should start with very simple low cost items, that is take 5 to 6 spoon of tila in the early morning in empty stomach, followed by 1 glass of lukewarm water. Then do tila taila or anu taila for Pradivasasya. Do oil bath head with Nirgundi Adi taila. Then Madhusnehi Rasayana is very good to prevent or cure thyroid complaints. Then Snehapana with Tilathaila or Gulgulu Grita or Varnadigrita in Shidaka. Varnadigrita should be done only in Shidakala, means June to December. Otherwise may arise some allergic itching, etc. Then it should be done as Vicharana, that is starting with 1 teaspoon entering to 1 ounce at bedtime. Bedtime means after taking dinner as some fruits and vegetables only, no any heavy items. Then only it will work very well, and we can see a very speedy recovery. By following above things regularly, we can prevent or cure thyroid disorders. Then Jalarasayana. Drink 6 to 8 glasses of water boiled with guava leaf or chiku leaf and mango leaf. These 3 leaves are very much effective in Galaganda, also to prevent diabetes and hypertension also, and for all inflammatory conditions also. Then do Snana, Nasya and Shirodhara with Shuddha Jala will help to prevent thyroid disorders. So for poor people, we can do these all items. Then Gulgulu Tikka Madhusnahi 1 teaspoon at bedtime can cure thyroid disorders as well as can prevent any types of tumors. That much powerful it is. Then pranayama. Nadi Shuddhi pranayama. It is very simple to do. Aniloma Viloma. Then Bhasriga. These 3 are very simple to follow daily after simple yogasans. Very easily. Some simple pranayamas if do early in the morning in Yoga Nidra with breathing exercise and auto suggestions followed by yoga, breathing suggestions in Yoga Nidra. We can prevent thyroid disorders. Then when I analyzed the number of thyroid patients in my hospital within last 1 year, I could see around 99 cases in which hypothyroidism only was 85 cases, then hyperthyroidism only 1, Hashimoto's thyroiditis 2 cases, multimodular goiter 9 cases, and thyroid cancer 2 cases. We can enter to thyroid cancer. Before entering to because our textbooks are saying very little about the cancer description and treatments, so we have to go for some modern. It's a disease in which malignant cells form within the tissues of the thyroid gland. Its causes may be genetic or environmental factors. When cells in the thyroid undergo genetic changes or mutations, the mutations allow the cells to grow and multiply rapidly. The cells also lose the ability to die as normal cells would. The accumulating abnormal thyroid cells form a tumor. The abnormal cells can invade nearby tissue and can spread to other parts of the body. Symptoms: a lump or nodule that can be felt through the skin in neck. Changes to the voice, including aphonia or hoarseness. Difficulty swallowing, pain in the neck and throat, swollen lymph nodes in the neck. Types of thyroid cancers are papillary thyroid cancer, follicular thyroid cancer, anaplastic thyroid cancer, medullary thyroid cancer, and other rare types. According to Ayurveda, we should treat the case according to dosha vedana symptom wise. Then papillary thyroid cancer, the most common form of thyroid cancer, which arises from the follicular cells and which produce and store thyroid hormones. Papillary thyroid cancer can occur at any age, but most often it affects people in the age group 30 to 50. Follicular thyroid cancer, it affects the follicular cells which arises from the follicular cells and It affects the age group more than 50 years. Then anaplastic thyroid cancer, which is a type of rare type of thyroid cancer that begins in the follicular cells itself. It grows the change is it grows very rapidly and is very difficult to treat. Anaplastic thyroid cancer typically occurs in adults in 60 above age group. Then medullary thyroid cancer. Medullary thyroid cancer begins in thyroid cells called C cells, which produce the hormone calcitonin. Elevated levels of calcitonin in the blood can indicate medullary thyroid cancer at a very early stage. Certain genetic syndromes increases the risk of medullary thyroid cancer, although this genetic link is uncommon. Then other rare types are thyroid lymphoma, which begins in the immune system cells of thyroid, and thyroid sarcoma, which begins in the connective tissue cells of the thyroid. Risk factors are for it is maximum risky if it is a female, then exposure to high levels of radiation, certain inherited genetic syndromes, then that increase the risk of thyroid cancer include familial medullary thyroid cancer, multiple endocrine neoplasia, Cowden's syndrome, familial adenomatous polyposis. Then complications are thyroid cancer that comes back if microscopic cancer cells spread beyond the thyroid before it's removed. Then thyroid cancer may occur in lymph nodes, in neck, other areas of the body such as lungs and bones. Then it will be complicated. Thyroid cancer that occurs can be treated, but prevention is better than relapse. Hence, preventive measures should be strictly followed. Same time, periodic blood test or thyroid scans also should be done to check for signs of a thyroid cancer recurrence. Then chances of recovery is according to the age of the patient, type of the cancer, stage of disease, whether the removal of the gland done completely, including sentinel lymph node. Sentinel lymph node means the nearest lymph node to the thyroid gland have the maximum chance to spread. Metastasis to any other organs, including lymph, bone, lungs, etc. According to these items, only we can say how much is the chance of recovery. Then treatment in modern medicine included for overgrowth, definitely should send the patient for surgery and followed by radioiodine therapy, because radioiodine therapy is I think more than 90-95%. It is effective to cure thyroid, all types thyroid cancers. And if there is metastasis, there have chance for the chemotherapy, then targeted therapy and immunotherapy. Radioiodine therapy that used for treatment can be absorbed by thyroid gland, which will destroy any thyroid tissue not removed by surgery or to treat thyroid cancer with metastasis. More useful in papillary and follicular thyroid cancers. In medullary and anaplastic thyroid carcinoma, radioiodine therapy will not work because in these types of cancers, the tissue do not absorb iodine. That also we should know. So please don't send the patient for that treatment. Then Galarbuda, according to our science. According to Vagbuda, explained in Kandagada Roga, vacated Vadadi doshas produce a hard, immobile, painless, non-separative reddish tumor in the throat known as Galarbuda. That is the description about Galarbuda in our Ashtanga Hridaya. And according to Ayurveda, we can for all types of cancers and tumor growths. The treatment we can conclude as what our science says is Arbude Grandivat Kuryat Edasum Staranhidam, like that. The Grandivat treatment should be adopted, including Yukti Aushadasa. So thyroid cancers also we can treat like the same. I treated in the above manner. That is with starting with Mrudu Sneha Sweda Vireka. Then Chedana is the surgical part. Yet we have not allowed for the surgical treatment. That is why for my patients, I was sending them to modern oncology department for Vedana also. Then Raktamoksha we can do very well. That it is a wonderful treatment. Then the Dahana Karma cauterization we can do by our Chara Karma, Palashak Shara, etc. Then Arobana healing part. Then Chedana and Vedana Karma we are doing with the oncology side. If it is practicable in our in Kerala in the future, there have a chance to do by ourselves. Then Raktamosha is a wonderful treatment to cure any types of cancers. Here, in case of thyroid, it is better to do Raktamosha from both hands by scalp, and with the I think with the small Jalaukas we can do Jalauka locally also. There have chance to reduce the swelling and growth very easily, with followed with Krishna Labas. The karma should be done to root out any cancer cell persisting in the surgical area and to prevent further development through blood or lymph. Two ways of the karma we can be applied. That is Palashak Shara for external application and Kalyan Shara for internal application. Then Arobana part. Our Shamana karmas like oral intake of Shamana Aushadhas like. According to the situation, we have to select the medicine anyway. Tab Kachaya or Tab Nimbadi, then Kachaya or Tab Granadi, Kachaya or Tab Bulguru Tiktaga, and Tab Kanjanara Bulguru, Tab Protect. Protect is not capsule, it is also Tab of Nagarjuna. Then Gaitarin Tab, Thyroflux capsule, Tab Thyronil. Then Tab Mansamitra is a must for all types of thyroid cancers, because most probably their willpower will be in very low level. So Mansamitra will help to work the medicines very well, also to accept grasp the medicine and make the patient maximum confident with other pranayama, yoga, dhyana also. Then Tab Hima is the best hematinic tablet with milk because it contains the rice bran, triphala, and Loha Basma. Varanadi Kruda in Shitakale due to the presence of Balaka. It is also a wonderful remedy to cure, also to prevent thyroid cancers and goiter also. Gulgulu Tiktaka Kruda in all seasons we can be applied, because Nimbamrada, Vrishapadoladi, all medicines we can see with Triphala. It have the Tridosha Hrata Bhava. Then Chantamarada Sindhura. Chantamarada Sindhura is the Vajrayuda to cure thyroid cancer only, not for other normal situations. If Gandamala is in the severe form, then also we can apply Chantamarada Sindhura with Krusravatya up to 3 months. Chantamarada Sindhura only should apply for 5 days with Krusravatya, and the Vatya should be continued up to 3 months. Within 3 months only, complete healing, repair, and cleaning, repair, and healing part can be completed. Then Yoga Dhyanadi, then Marma massage. Marma massage means with on the Sumai Marma, on the neck, 3 times upward and this type of upward and downward gentle massage on neck on friend daily one time. It is very good to stimulate the gland to come to the normal level and to produce the T3, T4. Then Apanarbo Chilsa. Mrudu Sneha Seda Virega in Rudu Sandhis, that is tri-monthly in the starting of the tri-monthly means in the starting of each Rudu. That is in Kerala, it is the Shodhana part should be done in the end of May, that is in the starting of monsoon, and in the end of November, September, November, that is on the starting of winter, and during January last or February, the starting of summer. It is to prevent all types of diseases also, especially this type. Then intake of some preventive medicines like Kanchanara Gulgulu, Gaitarin Gulgulu, Tikta Kritam, Varanati, Himata, Bilaksha Gulgulu, Chyanprash, etc. Chyanprash also Brahmarasayana. We can no need of these all medicines according to the need of the patient, their age, their Tehabala, etc. We can select and the medicines and its dosage. After completely, if the patient is following very strictly our medication, I think within within first 6 months we can cure the patient 100%. With normalizing all the routine checkup reports and scan, etc., we can see 100% cure of the disease, and symptom-wise also and health-wise also, patient will be in the normal healthy level. After that, 1.5 to 2 years of preventive therapy means Apanarbo Chikitsa should be followed strictly. Then only we can confirm the chance of prevent the relapse of the disease. Then practice of yoga Jnanadi daily as part of life. Follow Ichapatya diet lifelong. Keep an enthusiastic, happy, optimistic, and a respectful, loving, and caring mind always. With the above features, we can not only prevent thyroid cancer but also can stay healthy and energetic throughout the life with Ayurveda. Then, up to the complete functioning of the thyroid gland, how we have to taper the medicines, therapeutic medicines. I reminded in the first once more. That is, whenever T3, T4, and TSH comes within normal limit, we should allow the patient to continue the dosage of hormone tablets like Thyronum, Alproxin, or any other medicines which modern doctors prescribed. We should, up to the normal level, we should allow them to continue, and then only the purpose is then thyroid gland get a rest, complete rest and relaxation, and so we can do the cleaning, our Shodhana, Shamana, and Abhinarva part, that is cleaning, repair, and healing work with our medicines easily. It is necessary in the thyroid diseases also, in the thyroid cancers also. Then, a treatment experience of normal thyroid case, not confirmed as cancer. That is, a patient came 3 months back. That is a lady with 32 years who was my patient 6 years back with infertility, and she conceived within 3 months. Now she has a 5-year healthy female baby, and she wants a second one. I forgot the case really. What were the complaints she had at that time? Vague memory is she had irregular periods and just starting of thyroid complaint at that time. On detailed case taking now, found out she is not having regular periods and she was on 150 milligram cap Thyronum. But due to severe reactions against the drug, against this Thyronum, she stopped that medicines 1 month back. She told after starting the Thyronum tab, she started always sleepy with excess fatigue. She can't be done any duty in her as her household duty or to care her baby or anything. She was around a completely bedridden situation, and she stopped by self the medicine. And then I checked her TSH level. It was 374, and HB was only 7 grams percentage. But she told she can't take Tylenol or any modern medicine due to the excess drug reaction. Then soon started with our medicines like Varanadi Krida, because 3 months back, just on the starting of winter, so it was easy to apply. Varanadi Krida, Kanchanara Gullu, Ekarin tablet, Thyroflux capsule, and Himantablet. These were the main items. And I think Hridrakandam and Immunoplus. Immunoplus is the empowered form of Indukandam yoga. It is of Nagarjuna. It is highly powerful. The mixing of these two with Vyoshati Vadaga also were given, especially to prevent corona like all infections and to prevent any infection or inflammation on her thyroid gland, because they had little being from a very poor family financial background situation, she was not ready to go for any scan or any other further checkups. So I just started to the patient with these medicines, and within it was one of my outside OP where I am going only monthly one day visit. Then next month only I could see her. She came with the blood report with the reduced TSH level to 190, from 374 to 190 within 1 month medication, and HB increased to 9 grams. And then continued the medicines again. In checkup after 1 month, TSH level was 92 only. From the 190 level, within 1 month, it came to 192. Then HB became 11. Then again in the third month, TSH reduced to 50 and HB became 12. Her health, the same time, each and every week, she could feel the maximum recovery of the complaints, and she became 100%, almost 100% healthy. And continue the medicines according to the symptoms. Now, when I asked her to check up again last week, I telephoned her to check the TSH level and HB again. She telephoned me that TSH has reduced to 11. Then see, on 3 months back, it was 374. With only our medication, it came to around near to normal level, that is 11. And now she is 100% healthy. Her periods, this is also became as a wonder. Her lagging periods. Lagging periods means she had the last period 6 months back. She told her periods also became normal, and I have repeated the medicines, yoga, breathing, exercise, etc. to continue for next 1 more month. And within the busy schedules, I couldn't collect the reports and to add in this paper. This is my first experience without any modern medicine, patient becoming 100% healthy and the TSH reducing to around normal in a short span of period. Most probably within my next visit, I think her TSH level will be below 5. This is and modern science says if the TSH level comes very higher ratio, there have a chance of cancer. But in this case, I couldn't do any checkups. So anyway, she is maximum healthy now. So I want to start the infertility for a second child, infertility treatment. Then in case of thyroid cancer. In my first experience was 28 years back. That is in the just starting of my practice, just after completing my KMS. That was that 48-year-old lady. She was a returned case from RCC, Regional Cancer Center, Trivandrum, with 2 months long heavy uterine bleeding due to uterine metastasis. 4 or 5 years back, she had started thyroid cancer and had completed 1 full course of chemotherapy, iodine therapy, etc. Had subsided the complaints, but within 3-4 years, she started with maximum complaints and with metastasis on bone, uterus, lung, etc. And she couldn't tolerate the further treatments with the chemotherapy, etc. And they returned back to, they were from Thrissur. So RCC center doctors, they told for to follow any palliative care only. But at that time, there had no much palliative facilities at Thrissur, and they came knowing about our treatment in my OP. At that time, I had no hospital facility, and she came. The situation was so horrible that it was continuously uterine bleeding. She was so much pale. I think HB was 4 or 5 only, and her body was completely swollen and fully breathless condition, and just as a dying stage, she came. The family brought her in my OP. I was really afraid. But after starting our medication, hematinic tablet, Hematab like or Mandurevadaga, and Nimbadi, Varanadi Kashayas, then Pushyanaga Churna, Pravala Basma. I have no the case file because it is 28 years back in my OPD. These medicines, and followed by within this Pushyanaga Churna, Pravala Basma, etc. Within 1 week, they told almost her bleeding got arrested, and with Mandura Mataka, Bulguru Tikta Grada, etc. Gradually she and Mahadanandra Goliga, Swasananda Goliga, etc. were also given with the Jeera water, and Kasturi Kalparasayana also. Within few days, her breathlessness reduced, and HB level improved, and in the OP level itself, I gave them Chandamartha Sindhura first, then followed by PSK. PSK means Pravala Somakalpa Sindhura. That is Rasa Sindhura mixed with 2 times Kandavasma and Pravalabasma. In strict Krishnapatya, I teach them very well, trained them, and gave to take at home. And it is only for 5 days. Within first course itself, within 1 month, she returned back to around 50, more than 50% healthy condition, relieving almost all the complaints. And I repeated the medication for up to around 6 months. In between 3 times this Siddha medicine application, within 6 months, she became 100% healthy. It was so amazing for me because it was in the starting period of my practice. And since even now, she was almost healthy up to last 2 years. That is around 26 years. She was working hardly, and but she shouldn't, due to the poverty at home itself, she couldn't do the follow-up treatments for much time, and she having came to my OPD, but last 2 years back, one of their neighbor came in my OP, told she developed some growth in her breast, and in the checkups found out it as malignant, and they removed that gland and underwent a course of chemotherapy, and they came for the preventive medicines in my clinic. Then after 26 years only, after starting the Apatyahara, because she was very much in favor of taking non-veg items, and no any health-wise, being a lady from a poor family, she couldn't do any follow-up. That may be the reason. Anyway, it was a 100% successful case up to 26 years from the end stage of returned thyroid cancer. That was my first experience. After that, 93-year man in the end stage also came. I could give him very little palliative relief only with some palliative items. But he got a calm and quiet death. After that, 2 thyroid cancers. One was with a large tumor in the neck. I sent them for surgery, but after getting some relief for his complaints with our medication, sent him for surgery. But after surgery, they haven't came here. He was from Palakkad, so couldn't get any news about him. Then 2 or 3 cases in the past I have treated. They also has got maximum recovery. This is my experience. Thank you. So, for any of your queries, from my little knowledge, I can answer. Yeah. Hello, doctor.
Hello.
Hi.
Thank you so much, ma'am.
Okay.
Yes, ma'am. Thank you so much. It was really informative. Some of them have already made some queries. We'll go through it.
Yeah. Yeah, doctor.
One of them have asked, like, ma'am, could you please explain us the content of HEMA tab? Because in many of your treatment experiences, you have included them.
Okay, Hemata is of Nagarjuna. This 100% effective means most of the cancer patients are coming with a very reduced level HB 4, 5, 6, 7 like that. If we start with this Hematab, and also we are giving some vegetable soup with beetroot, carrot, tomato, little red spinach, onion, etc. Available other some vegetables. Cook well with a little more water in a cooker, and squeeze the juice. And if we give 1 glass of this juice, then this Hematab, definitely within 1 month we can see the HB level is coming above 10, and within next month it will come above 12, 13, 14 like that. That much powerful it is. That may be the ingredient rice bran, triphala, and annabedi. It should be taken with a little milk because of annabedi ferric form. It is very easy to take also. Is the next question, Dr. Devi?
Thank you, ma'am. Thank you, ma'am. Ma'am, the next question, it was clear, ma'am. Thank you so much. The next question is that, ma'am, the relevance of Kasturi Kalpa Rasayana in thyroid.
Kasturi Kalpa Rasayana. Just a moment, I forgot the name of the company. Kasturi Kalpa Rasayana is very high, it will penetrate the action of all other medicines in the body. That is the main action. If we take this Kasturi Kalpa Rasayana, if add 10-15 drops, it is a watery form, 10-15 drops in the Jeera water, and take with all other medicines. All medicines work very speedily, 10 times speedily in the body, in the affected part. That is I have noticed. And it will make a Vada and Lomna also, especially in breathless condition. Very speedily it will reduce the breathlessness. For all Shwasa Kasa case also we can. Pleurisy, pneumonia, tuberculosis, in all the such cases we can give prescribe Kasturi Kalpa Rasayana. Forgot the name.
Ma'am, is it this Kasturi Kalpa Rasayana, is it meant to like increase the HB count? Is it something like that?
No. It is a vehicle to work other medicines very easily in the body, especially to reduce breathlessness. Himatab is the number one medicine to increase HB count.
Okay, thank you, ma'am. Thank you so much. So this Kasturi Kalpa Rasayana will act somewhat like a yoga vahi.
Yeah.
Okay, thank you so much, ma'am. And ma'am, one of them have also asked like importance of tila seeds. Could you just please explain, because it is a very easy thing which we can adopt in most of our cases. It is homely, no? So to any of the patients as a home remedy also we can ask them. So can you just explain a bit more on the concept of tila seeds in the usage of thyroid disorders?
You may remember in our Rasayana chapter, there have Tila Rasayana. The description is just to take 5 to 6 spoons of Tila early in the morning, followed by 1 glass of water. That is the application of Tila Rasayana. Tila is the number one medicine for the complete and harmonious repairing of each and every cells in our body, especially in throughout our intestine, throughout thyroid gland, throughout lungs, like this all vital organs, for a cell by cell cleansing, repair and healing. The number one remedy is Tila. That I have experienced in my hundreds, not hundreds, thousands of patients. That much wonderful medicine it is. That is why I am using that.
Thank you, ma'am. And this Tila, does it have a powerful action in order to improve the hormone efficacy, hormone secretions, etc.? Does it have a direct relationship with the hormones?
Not direct, indirect relationship only. Whenever all the altered or diseased cells relieved and a new healthy cells comes and the organs comes to a 100% healthy level, the hormonal actions will also get to the normal level, harmony level. That wise indirectly.
Ma'am, this Tila Thaila, the use of Tila Thaila as nasya, especially in cases when there is severe kapha increase, or in cases when there is delayed induction of menses or menstrual periods, when the menstrual period menarche gets delayed. So I've seen 1 or 2 doctors prescribing Tila Thaila nasya. I don't know about its outcome as such. So is it, in your experience, have you seen anything relevant about that, using Tila Thaila as nasya?
Tila Thaila as nasya is good to just also as the complete regeneration of body and cell by cell normal cell repair and rising of normal cells, especially in vital organs like lungs, brain and thyroid. But for nasya, the highly potentiated form of Tila Thaila is Anudaila, you know. So I am giving Anudaila for nasya. And being a arthopravartaka aushadha, Tila prayoga should be avoided at time of periods.
Okay. Okay. Thank you so much, ma'am. Going on to the next question. Regarding the hematab only, one more query has come up. It is like, ma'am, if the hematab contains iron in it, and if we are giving the tablet along with milk as Anubana, so will it form a chelation between calcium and iron? Will there be a chelation occurring between calcium and iron?
No relation with calcium and iron. In most of the thyroid complaint cases, HB level will be in the lower form. That is why I have prescribed. In that experienced case, her HB was 7 like that. That is why I prescribed that. For the easy absorption of calcium, definitely a cell by cell repair and healing of the thyroid gland should be done. And if the calcium level is low, we should apply any other calcium supplement, calcium plus Laksha Bulbulu like that.
And thank you so much, ma'am. Another question is like, which kind of salt we should we stick on to the rock salt or like the iodized salt?
If there is any chance of thyroidism, definitely should take iodized salt. I think especially in the town areas, it is must to check our TSH once in a while, every 6 months or yearly once. And TSH means TFT. If there is any reduction, definitely we should take iodized salt. Otherwise, if it is in the normal level, no need. It is better to take rock salt only. Rock salt fried well and powdered. That's good.
Okay, ma'am. Can you please explain us your experience on the use of Sharas in the cancer cases, not only just thyroid cancers but other cancers also? Usage of Sharas and its relevance.
Charas has to be applied with maximum care. Very rare cases only I have practiced with the Palachak Chara and Kalyam Chara. Because if the patient, especially for internal application, if the patient have acidity, hyperacidity, we can't use Chara because it will maximize the acidity and may make ulceration. So in such cases, we can give Chara Aushadas. So most probably for the internal application, I am using this Somakalpa Sindura, Chandabara Sindura like that. With the maximum care, it will not make any harm to the body. More than that, at time of complete cure of the disease, same time it will maximize the body energy level, maximize the maximum. It will prevent other diseases also. That is the side effects of our Resauchadas. So for internal use, I am using Resauchadas. For external application, we can use Palachakshara. With that, instead of Chaitana, and we can apply these, and Robana effect also is there. Before that, otherwise, with that, we can make use of Parachurna, Nagaradi Churna, etc. If there is ulceration in the thyroid gland, especially with any type of cancer, growth may become ulcer form, cancer Arbuda Vrana, that in such a situation also Chara cannot be used. It will maximize the Puya form, first form. So it should be done with maximum care. I don't know if any one of our doctors are doing it with the safe level. I don't know about that because I am using maximum Rasaukshadas for the same.
Okay, ma'am. And in your opinion, ma'am, which kind of Shara would be good? Paniyak Shara or Pratisarniyak Shara?
Which please repeat once more, Dr. Gavri.
Ma'am, in your opinion, in the usage of ksharas, which kind of ksharas would be good? Paniyak ksharas or pratisarniyak ksharas?
Pratisarniyam we can apply externally. Paniyak Kshara for internal use. Paniyak Kshara is the best, but checking and ensuring that patient is not having acidity, hyperacidity, or also Parinamashula. Then we can do that. Giving Kricharapathya diet means Palkanyi, milky gruel, and fruits as diet. Then it may not be harmful. There have chance for getting maximum result. Paniyakshara.
Okay, thank you, ma'am. Going on to the next question. One of the attendees have just shared a case with us. I'll just read out it. On USG neck, colloid cyst with cystic degeneration was observed, and the thyroid profile was normal. What can we think about this case?
That we can treat with just as a Granthi. And one with a routine blood test also should do CEA, carcinogenic embryonic antigen. If there is any chance for canceration in the near feature or in the nearest organs like liver, lung, etc., we can get information about the same. And we can do the treatment as Granthi Chikitsa with Ruksha Lebanas externally, and our medications like Nimbati, Tayandyati, Gulgulu Tiktagam, Kashaya, or Gulgulu Tiktagarda, etc. Madhusnehi Rasayana. We can cure the case very easily. In such case, we can do Raktamosha treatment also. That we can take as a Gandamala. Other parameters.
Okay, thank you, ma'am. Excuse me, ma'am, for other parameters also?
Should be done and should make into the normal level. Blood test, urine test, scan, ultrasound test, like that.
Okay. Thank you so much, ma'am. Now the next question.
Yeah.
About that, ma'am. Can you please share your opinion of using Kshiradhara Churnam or Bela Churnam or Amlaki Churnam? Does it give results?
Amlaki Churna for Amlaki Churna, where I mentioned.
Ma'am, it's not like it is just she's asking a question whether can we use Kshiradhara with Amlaki Churna or Bela Churna or Varnadi Churna. So if you do a Kshiradhara, will there be any results?
Okay, there can be a good result with the same, but I haven't done at that Kshiradhara in this case.
Okay, ma'am. And one more question is that, ma'am, what is the relevance of, how much relevance is there for Rakta Moksha?
How much it is?
Thyroid disorders.
Effective, yeah. Rakta Moksha, in the past,
how much good it is?
I was not done Rakta Moksha for my earlier patients, but nowadays in most of the excess growth in all cases, as especially cancers, I am doing Rakta Moksha. It is giving more than 50% recovery with that treatment itself. So why not? Definitely we all should be done that Rakta Moksha treatment, because it makes a very speedily and purified blood circulation in the area, and it will help to work the medicine well, and it will help to cure the disease easily. So definitely Rakamosha we can adopt. Even in OPD also we can do as scalp application on the elbow crease or Jalauga on the local area, localized area. It is very easy. If we do treat with the mere medication, we can see in between the weekly ones. If we do Rakamosha, we can see at 10 times speedily the patient is getting recovery. That is the wonderful result of Rakamosha. So it is my request also to our all doctors to follow and to do Rakamosha for our patients, and please give them a speedy recovery.
Thank you, ma'am. And in the Raktamoksha itself, which kind of Raktamoksha do you find the best? Is it Jalauga Avjaranam itself?
Jalauga Avjaranam is so much a safe one, because in being the neck very Vishuddhi Marma area, it is not easy to do Prasthana or any and Siraveda like that. So Jalauga Avjarana is the maximum safe modality of Rakamosha locally. And from the elbow crease, as a scalp application, that also will work very well. For all diseases above the diaphragm, I have seen not only above the diaphragm, for liver complaints, kidney complaints, and pancreas complaints also have noticed Rakamosha from the hand, elbow crease. It is working very well, very easily, recovery speed.
Ma'am, that we have to point out when we do Raktamoksha in thyroid disorders, or is there any other areas? Because some do it in the veins going through the forehead and all. So some may apply, some applies directly on the neck region. So which one do you usually follow?
Yeah, we are doing Rakamosha
while doing
almost daily in our hospital. For almost all cases, for almost all age groups, we are doing Rakamosha. That much speedily, we can cure all the diseases. On the scalp also we are doing. Scalp, Prachana and Jalauga Avjarana we are doing very easily. If we do on the scalp, we can see very speedy relief of headache, especially headache, and a very speedy growth of hair. We should do the Prachana, just pricking with number 12 blade, and should apply the vacuum extractor on the area, and we can suck the blood very easily. That is the method on scalp. Neck also, if Jalauga is not available, we can do a little area, just prick with number 12 blade, and put a small vacuum extractor, and if we suck, that also will be very easy to drain the blood. That vacuum extractor should be with us for all types of Rakamosha. After getting that, Rakamosha treatment became very easy for us in all areas.
Thank you so much, ma'am. Ma'am, in your experience, when you're like treating along with the hormonal therapy, that is modern thyroid medicines, you told you will be treating, giving Ayurvedic medicines also, and slowly we will be tapering. Once in 3 months, we will be regularly checking and tapering and coming.
That is the normal method. But now, 3 months back only, I got it was really wonderful for me getting that much reduction of complaints and a reduction of TSH level from 374 to 11 within 3 months. That also a wonderful thing. So in such a situation also we can treat the patient well and we can offer them maximum relief. That is the information I got from that case history. Up to that period, I was not sure to give that much result with our treatment and medication. That case I treated only in OPD only with mere some medication for 3 months. That was a sinking stage when she was in the first time with the 374 TSH level.
Thank you, ma'am. And one more thing, we have just summed up about the general things that we have to avoid while having a thyroid disorder. Other than that, could you just specifically say that what hypothyroidism, what hyperthyroidism?
The difference. I think more the loss of losing
mainly the avoid, that is a must avoid thing for hypothyroidism and
in the treatment level. Hypothyroidism, the detailed items I told. And in case of hyperthyroidism, mainly we can treat with Brahmana Aushadas. Same time, food items having the same Sabhava, Brahmana Sabhava items, you have to give them. Banana is the number one best food, and chiku fruit. You know, chiku fruit.
Yes, ma'am, we know chiku fruit.
Yeah, then that's also found very much effective in this case. And anar is so good. And normal whole fruits and vegetables can be given. Only should avoid more acidic and alkaline items. Acidic means all citric items. And alkaline items means raw mango, jackfruit. Then in vegetables, brinjal. Then bitter gourd, bottle gourd, etc. That all items also should avoid at time of intake of Ras Aushadas. It will reduce the action of power of Ras Aushadas. That is why at that time also we should avoid that. In thyroid cases, these items are not found good. So, brinjal and savory citric items. Banana, anar, chiku, then guava fruit. These all items can be taken.
Ma'am, what about milk
soya
and
also
milk
is good
products?
for. Pardon?
Soya is?
Pardon? Soya is good.
Milk and milk products, ma'am. What about soya is good?
Milk and milk products. Milk, little quantity can take with medication, and much quantity milk, butter, and curd should be avoided. It will aggravate the quantity of flour, and it will aggravate sleshma. So it is not good. The highly diluted milk grinded with lemon leaf, curry leaf, and little ginger, and squeeze well and filter well, and added with 4 or 5 times of water. It is called in Kerala as sambara. It is very good. That milk item only can take in normal level. Other all milk items, it is better to avoid. Ghee also can take. This Varnadi Kudulu are taking as ghee. And ghee in the food also, it is good. Then what was the next one you asked?
Ma'am, soya is good for hyperthyroidism.
Soya is good for hyperthyroidism because in the breaking period we are avoiding all types of non-veg items, especially red meat. Soya is available in the market as meal maker. We can make it as just like as meat curry. So it will be favorable for patients to take. So and soya milk also is good. It is the best antioxidant also. You haven't found aggravating the Leshma Vada or Pitta any Dradosha.
Okay, ma'am. Thank you so much. That was a contradictory topic, soya. Right from the first class onwards, soya was a very contradictory topic for us.
Yeah.
Thank you for clarifying it. And ma'am, there is one more question. It is like if a patient exhibits both menorrhagia along with hypothyroidism, what can we do?
Yeah, menorrhagia with the hypothyroidism. For the hypothyroidism, the normal medicines, especially Varanadi. Varanadi has the effect to prevent menorrhagia also. Have you noticed that? There have one medicinal formula containing mainly Varana to prevent all types of menorrhagia. I forgot the formula. It is available in the Madhava pharmacy. When medicine was there. Anyway, Varanadi Grada and Varanadi Kashaya will be highly effective to cure thyroid complaint, also to prevent menorrhagia. At the same time, we can give one tablet is the Leucorid. It is of Nagarjuna. The main content is Shilajadu. Leucorid tablet if take from 4th day to 23rd day of period. That is in between two periods. It is for 20 days. Like that, 3 consecutive periods. If we take this Leucorid tablet, the menorrhagia will reduce and it will come to the normal level of 28-day cycle with a 3-day normal flow. That is the magic of Leucorid tablet. And if necessary, can give Pushyanaka Churna also. With that Immunoplus powder, equal quantity Pushyanaka Churna, taken barley water, means the rice bran mixer, boiled water. Otherwise, in milk water also can take that powder, Pushyanaka Churna. With Pushyanaka Churna and Leucorid tablet, definitely within 2 or 3 months, it will be in the normal form of normal periods. For any type of menorrhagic condition, it is a wonderful formula. If necessary, Musari Kadiradi Kashayam also can give past 2 weeks. Is it okay?
Thank you, ma'am. Thank you, ma'am. Thank you so much, ma'am. The one more question is that, what in your experience, what do you feel? Is hypothyroidism easy to manage or hyperthyroidism is it easy to manage? And in which kind of Prakriti, which type Prakriti people do we find easy to manage these conditions?
Anyway, the Dradosha equilibrium Prakriti is good. But in hypothyroidism case, we can notice Kabadika condition. Anyway, if we treat with the medication, same time strict diet, same time strict Vyayama, yoga, pranayamadi, definitely it is very easy to treat the hypothyroidism. And hyperthyroidism, it is very rare to get the case. Anyway, that case also I could treat very well that with the Brahmana Chikitsa. Within 3-4 months, we can see the patient is getting to the normal healthy condition with the Brahmana medication and food items and simple, very simple vyayama, yoga asanas, and first few weeks we should instruct them to avoid all types of exercises because they may have high level tachycardia and breathlessness, etc. So first few weeks definitely should avoid exercises, yoga, asanadi, all types of outdoor exercises also, and should instruct them to follow with the just breathing exercise. Do you know breathing exercise in Yoga Nidra? It is a simple way to follow for any age group. That is just lie on the bed or ground with the stretched legs and hands, close the eyes, and with the internal eyes, internal mind, see our head to leg, fingertip, all the part, one by one parts of our body, and just feel all organs are getting maximum relaxation, just like internally also. We are giving complete rest and relaxation. Imagine that within that 2-3 seconds, we can know a completely relaxation of the body. That is the form of stage of Yoga Nidra. In such a Yoga Nidra, we should give positive suggestions. That is, at time of inhalation, imagine the maximum powerful prana energy in the earth is coming into my body, especially through my all chakras from Sahasrara Padma to Mooladhara. It is filling all my chakras, and it is injecting to all weakened areas, and it is making complete repair and healing of the disease. With that thought, the same time should imagine it is entering and should fill our mind with maximum happiness, maximum love, maximum caring mind, maximum optimism throughout our body and mind, and should hold the breath for 2 seconds, and with around 8 seconds exhalation, should imagine all the diseases and all the tension, worries from my body and mind is releasing. Just and should imagine it is going like that. At the same time, all types of negative tension, worries, hatredness, jealous, everything, all the tension about the disease or other things, everything negative urjas are releasing from our body. It is very simple to do. I am treating each and all our patients in my hospital and OP to do with this breathing exercise, with these positive suggestions. And if they do start the treatment like that, I could see in each patient the medicine treatments, everything, whatever we are giving them, it is working very easily in their body. So it is a must. We all Vaidyas. So please do, all our respected doctors and Vaidyas, please do by self and instruct to our patients. Not only thyroid cases, for all cases, especially complicated cases, to start the treatment with this auto suggestion with pranayama breathing exercise.
Thank you, ma'am. Thank you for the advice. And ma'am, what do you think about the application of oil on head for hypothyroidic patients?
Hypothyroid. In the first stage, that is the amavastha, should not apply any oil. It will aggravate it will maximize the release of with the release of kaba, sleshma, and may make a cold, pratishaya, jwara, etc. And the patient also sees their all complaints are aggravating with our treatment. We please don't do for not only for thyroid, in any cases. In the first stage of the treatment, shouldn't do any oil application externally. It is also should avoid internally. And in the second part, Pachamana Avastha also it is not good. In the third part Pada Avastha, that is in the healing part. We can start with the Nirgundyadi. Nirgundyadi Taila is the number one for thyroid complaints. Should start with one drop. First day, one drop within 5 minutes. Should wipe out and apply Rasnadi Churna. Second day, 2 drops. Third day, 5 drops. Like that, fifth day, 5 drops. Then the patient will not get any aggravation of the complaints, and it will be Satmya for their head, and can continue with that for a very long period, so that the recurrence of the disease may arrest, and to cure the disease also it is very good. Nirgundyadi Taila.
Thank you, ma'am. Thank you so much. And one more doubt is there, ma'am, regarding Sneha Bana. You've suggested quite some Snehas, Gritas, that is Varunadi Grita, etc., which is very useful in thyroid disorders. So, which kind of Sneha Bana do you suggest as a Shodhana, in Shodhana Matra or in Shamana Matra?
Shamana Matra as Vicharana. Vicharana means I am starting the patient just like this. Oil application on the head. Gridapana also we should make Satmya for the Satmya means it should make healing of the disease. At the same time, it may not be make any uneasy feel to the patient. So that just start with the 1 teaspoon for adults, and for kids with the 1/4 teaspoon, half teaspoon, and gradually aggravated day by day. 1/4 teaspoon to half teaspoon, then 1/3, then 1 teaspoon for kids and aged people. For adult people, starting with 1 teaspoon, next day 2 teaspoon, next day 3 teaspoon, like that up to 25-30 grams. That is 5 teaspoon, up to 5 teaspoon we can give. Whenever we aggravate the quantity of Grida, the same time should reduce the quantity of food during night. It is given only during night. And food means all starchy items should be strictly avoided. Instead of that, fruits and vegetables as soup, salad, or vegetables as curry with very little chilies can take. And gradually reduce the dose of that also, and in the end very little quantity of fruits, and increasing the quantity of Grida. So during the night, especially in that complete rest period, this Grida mainly will work for next 7 to 8 hours. So very speedy recovery of the disease we can see. That is also not only for thyroid complaints in infertility. If we give like this Snehapana, we can treat the patient in the OPD. From the oligospermia for male patients, and other anarthava stage for female patients, we can very speedily make them normal with this type of Vicharana Snehapana. I am doing like that in all such cases. It is very easy to also for the patient. They will not feel any uneasiness. Only in the case azoospermia, only I have tried in the Achapana of Sneha, starting from the early morning. That is 60 grams, 75 or 90 grams, 120, 150, like that. It's so horrible to take, but in azoospermia case, there is no other chance. That is why. In any of other diseases, I am not doing Achapana. Our Acharya says to treat any types of complicated cases, doing any types of treatment, but in the end they are saying the treatment should be Hrudyam for the patient. So they may not be in the repelling condition towards our medicine or treatment. That is why we should take maximum care to apply the medicines.
Thank you, ma'am. Thank you so much. Ma'am, what are the complications that you have observed while treating hypothyroidism? Or what are the complications, not only just in during treatment, when a patient comes to you itself, what are the complications that you have observed in a hypothyroidic patient?
Hypothyroidic patients, probably, I think there have no much complications. We can treat it as any other diseases. But if the patient having much intolerable conditions of any complaints like complete insomnia and certain people have full-time sleepy, very certain people have complete insomnia and daytime sleepy with lethargy, cannot do anything for themselves or for the home, live their children or anyone. In such situations, definitely we should allow them to take the modern medicines and should start the treatment with this Mrudu Sneha Sayata Vireka, Snehapana, etc. And should give them maximum relief immediately. Otherwise, they may get highly depressed and they have chance for even suicide also. Because due to the depression of they are useless for home. If they feel like that, it is very difficult to treat. So we should offer them. We should give them maximum easy cure. For that, the best option is start with counseling. The same time, yoga, meditation. After that, soon start the medicine. So it is very easy to treat it. 2 weeks back, one patient, one lawyer, came in my OPD with a highly complicated situation of thyroid, with a large hump, with acute dysphagia, hoarseness, etc. And just with the first glance, I could understand and understood that it is a case of carcinoma. And I sent him because he is only 30, 34, 35 age. Not 35, 38 year aged man. So I sent him for immediate surgery to a nearest hospital. They did the surgery, and after the surgery, he came back to me. I started anti-cancer medication, and they are preparing to start with the radioiodine therapy also. In such situations, we don't wait for the result of our treatment. Immediately should send the patient for surgery. Such very little complicated cases came in my OP. This is only 2 weeks back. So he is much thankful for us also by sending him for surgery and getting very speedy recovery. It will take time with our treatment. So we shouldn't wait for that, especially for such adult people. After 60 years, there have much chance for maximum recovery with our medicine itself. Especially for all types of cancers, I have noticed. After 60 years, the degeneration, the speed of degeneration is much, and speed of regeneration is much. So regeneration of cancer cell speed also may be slowly. That may be the reason after 60 years there are hundreds of patients are there having 100% getting cured by via our treatment. Various types of cancer patients.
Thank you so much, ma'am. Thank you so much for this valuable session. It was really a great eye-opener. And thank you for sharing your experiences also, and even discussing each and every point so detailedly. Thank you so much. I hope that all the attendees have also acquired quite a good time that discussing all these things, and hope all your doubts are clear also. Thank you everyone for being in this session, being all throughout all the sessions. Thank you so much.
one thing I have to share you that I'm extremely sorry for not making comfortable this from the starting, because after 7 p.m. only I could start from my hospital, and in the very busy schedules I couldn't make a good file of treated patients for this section which you awaited. So sorry for that. And thank you once more for giving me this chance to all our respected doctors for the patient hearing for me, and Dr. Jasul and Ayurveda ma'am. Pronounce.
Thank you, doctor. Thank you. And you were present in all our other sessions also, and keenly watching all our other faculties. And thank you for your kind patience, and also the hunger to get more knowledge. Okay. Thank you, ma'am.
Thank you, doctor.
Okay. And we are winding up the session. Thank you for all participants. We just planned for a 16 hours session, and we just completed around 20 hours in this thyroid itself. So I think it's the first session which completes 20 hours in a disease like thyroid. Thank you all participants, and we can further discuss in the Telegram group. Okay, thank you.